Hi, my name is R.Williams, and I'll be doing Module 8 focus assessment on Tina Jones, 28-year-old female African American, here for her pre-hire physical. This is my ID card, Texas driver's license. Okay. And I've already done a full comprehensive assessment and interview for Miss Jones. We'll begin, get her vital signs. Vital signs 128/82, stats 99%, room air, heart rate 78, respiratory 15, temp 37.2. Get a spirometer on her. Ask her to blow into the tube. Blow into the spirometer. Okay, perform the spirometer. Okay. Blow into the spirometer. FEV1 1.549, FVC 1.78 liters, and that is 87%, which is normal. Assess her orientation, and she knows her name, date of birth. Go ahead. Tell me your name and date of birth.
My name is Tina Jones, and I was born on February 17th.
What building are you in now?
I'm at the doctor's office at Shadow Health General Clinic.
What is the date and year?
Today's date is
and she is alert oriented ×4. I inspect her head. It's normal. Symmetry. No lesions, no spots, no masses, no contusions, no abrasions. Inspect her hair. She has hair covering her entire surface of her head, and there's no evidence of any sparseness, no hair loss, and her head looks symmetrical, normal skull shape and anatomy. Look at her scalp. No lesions, no debris, and I'll go ahead on and assess her scalp and occipitals and parietals, temporal. Everything looks normal. Look at her eyelids. Sclera is white. No abrasions, no redness, no scars, no scrapes. Pink mucosa. No drainage. No. Look at her eyes. Clear white sclera. Clear white sclera. Okay, check peripheral vision. Tell me when you can no longer see my fingers. Normal exam. Now look in her eyes with a ophthalmoscope. Okay. Alrighty. Alright, I do see some margin changes and look like some cotton wool bodies there. Okay. And that's her right eye. Oops. Left eye. Sorry. Ophthalmoscope. Come on. Left eye. there. Alrighty. Margins look clear, no changes there. Okay. Oh, do you see a little bit of bodies there? Just a little bit of changes to her margins and some kind of bodies to her right eye. Now look at the pen light. Okay, she has good pupil equals round, reactive to light, accommodation. Yes. Good. Normal exam. Look at her ears. She does have some coarse hair there. Look like some acne on her cheeks. The ears look symmetrical in line with her eye, and her earlobe pinna is in line with the corner of her eye canthus. Okay. In her ears, let's look at her nose first. Patent, no lesions, no bleeding, no polyps, no lesion, no polyps, pink mucosa for both sides. Gray, no cerumen, no bulging, no drainage, no scars. Tympanic is gray here too. No redness, no lesions, no scars, no abrasions, and no evidence of fluid. Mouth and throat, and I'll check her gag reflex as well. Press the tongue. Okay, tonsils look good. Pull up the tongue. Looks good. Pink mucosa, no lesions, no rashes, no swelling. Push tongue left. Push right. Alright. No abrasions, no lesions, no sores, no ulcerations, no smell to the breath, no extra salivation. Intestinal gag reflex intact. Palpate her sinuses. Okay, no tenderness noted. Again, no tenderness. Okay. Don't feel any masses, no lesions, and no tenderness there. Our maxillaries. No tenderness there. Reported, no pain. Going to check palpate her TMJ. Open and close her mouth. Open and close your mouth. No clicks, no rubs, no pain. Open and close your mouth. And this side as well. No clicks, no rubs, no pain. Intact. No dislocation. Palpate her thyroid. Okay. Alrighty. And have a drink some water. Normal, no nodules, no goiter. Okay. Oops. Too far. Check her cervical lymph nodes. Okay. Not palpable. Normal. 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 No lymph nodes palpable. Normal there too. And no pain. And no palpable lymph nodes there either. Palpate her axillary lymph nodes. And don't feel anything there either. Okay. Inspect her abdomen. protuberant, round. See some striae on the belly. Don't see any evidence of any respiratory distress. Symmetrical. Oops, sorry. The other side. And I do see she has excessive coarse hair below the umbilicus down to the pubis, and striae noted. No masses noted. Auscultate her abdomen. Okay. Okay, bowel sounds are normal active times all quadrants. Palpate her abdomen light. No masses, no tenderness. Noted. No masses, no tenderness noted. None there either. And down here. No masses, no tenderness. Okay. Skin is intact there. I'm looking. Palpate her organs. Check for CVA tenderness bimanually. No, can't palpate the kidneys. I'll check her liver, span, midline, 1 centimeter below coastal margin. Not able to palpate her spleen, which is great. And I'll palpate this side of her kidney bimanually, and no, normal, cannot palpate it. Let's check for CVA tenderness. No pain noted. No pain noted. And I'll palpate her abdomen deep. No abnormalities there either. No masses noted. No masses noted there. No masses noted there. No masses noted there, and no pain. And now percussor liver span. Liver span 7 centimeters, mid-clavicular line on percussion. Upper extremities. Check your DTRs. Two plus. Two plus. Two plus. Two plus. Two plus. Two plus. Now check her pulses. 2 plus. 2 plus. Both radials, 2 plus. Now check here at the brachial and radial. Check the other side.